Hey everyone! Today we're going to explore a topic that many people are curious about but often don't fully understand. Have you ever wondered why moles, also known as nevi, appear on your skin? These small dark spots can be a source of fascination and concern for many. Moles can appear anywhere on the body, but they are most commonly found on areas exposed to the sun. This is because UV radiation can influence their development. Are they harmless, or could they be a cause for concern? Many people have mixed feelings about moles, seeing them as either beauty marks or potential health risks. Understanding the nature of moles can help alleviate some of these concerns. Today, we're diving into everything you need to know about moles, including why they form, how to get rid of them, and the treatments available. Stick around to the end, and don't forget to like, share, and subscribe for more informative videos. We'll also discuss when it's important to see a dermatologist and what signs to look out for. You know, when we talk about moles, we're really talking about these little clusters of cells called melanocytes. These cells are responsible for producing melanin, the pigment that gives our skin, hair, and eyes their color. These guys are like the artists of our skin, producing melanin, the pigment that gives our skin its beautiful color. Melanin also plays a crucial role in protecting our skin from the harmful effects of UV radiation. Now, these melanocytes can sometimes decide to hang out together, forming a little club right there on the surface of your skin. This clustering can be influenced by genetic factors, sun exposure, and hormonal changes. That's what we call a mole. Moles are generally benign, but it's important to understand their characteristics and monitor them for any changes. Moles come in all shapes and sizes, from light brown to almost black, and they can be flat or raised, smooth or a little bumpy. Their appearance can change over time, especially during periods of hormonal changes like puberty or pregnancy. Fun fact: the average person has between 10 and 40 moles on their body, and they can appear anywhere, even on the scalp or under your nails. Some people may have more due to genetic predisposition. Most of the time, moles are totally harmless, just a quirky part of what makes our skin unique. However, it's essential to be aware of their characteristics to distinguish between benign moles and those that may require medical attention. But it's always a good idea to keep an eye on them, just in case. Regular self-examinations and dermatologist visits can help detect any unusual changes early. Moles can be classified into different types, such as congenital moles, which are present at birth, and acquired moles, which develop over time. Dysplastic nevi are atypical moles that may have a higher risk of becoming cancerous. There are also different types based on their location in the skin, like junctional, compound, and intradermal nevi. Each type has distinct characteristics and potential risks. Common characteristics of moles include their color, shape, and size. They can be round or oval, and their edges can be smooth or irregular. It's important to note any asymmetry, border irregularities, color variations, diameter, and evolution over time. It's important to monitor moles for any changes such as growth, color changes, or irregular borders, as these could be signs of something more serious. Early detection of melanoma, a type of skin cancer, can significantly improve treatment outcomes. If you notice any changes, it's best to consult a dermatologist, who can perform a biopsy to determine if the mole is benign or malignant. Early intervention can be crucial in managing skin health and preventing complications. So why do some people have a constellation of moles scattered across their skin while others have just a few? The answer lies in a combination of factors that influence mole development. Well, it's a bit of a mystery, but we do know a few things that can play a role. First up, genetics. Your family history can significantly impact the number and type of moles you have. Just like you might inherit your mom's curly hair or your dad's blue eyes, you can inherit their tendency to develop moles. Your genetic makeup can influence the number, size, and even the color of your moles. Some families have a higher prevalence of moles, making it a hereditary trait. Then there's the sun. Now, we all love a little sunshine, but those UV rays can be sneaky. Prolonged exposure to the sun can lead to the formation of new moles and darkening of existing ones. They can actually trigger melanocytes to produce more melanin, leading to new moles or making existing ones darker. UV exposure can cause DNA damage in skin cells, which can result in the formation of moles. This is why it's crucial to protect your skin with sunscreen and limit sun exposure. Hormones are another factor. Think puberty, pregnancy, even menopause. These times of hormonal upheaval in our bodies can also cause new moles to pop up or old ones to change. Hormonal changes can stimulate melanocyte activity, leading to the development of moles. This is why you might notice new moles during these significant life stages. And lastly, there's good old aging. As we grow older, our skin undergoes various changes, and new moles can appear as part of this natural process. While many moles appear during childhood, some decide to make a late entrance as part of the natural aging process. As we age, our skin changes, and new moles can develop due to cumulative sun exposure and other factors. It's important to monitor these changes and consult a dermatologist if you notice anything unusual. Now let's talk about mole removal. Moles are common skin growths that can appear anywhere on the body. While most moles are harmless, some people choose to remove them for cosmetic reasons or because they might be causing discomfort. It's important to understand the different methods available and the factors that influence the choice of treatment. Can it be done? Absolutely. There are several effective methods to remove moles, each with its own benefits and considerations. The choice of method often depends on the mole's characteristics and the patient's preferences, but the method we use really depends on the type of mole and whether it's causing any problems. Some moles might be flat, while others are raised. The size, shape, and location of the mole also play a crucial role in determining the best removal technique. Additionally, the patient's medical history and skin type can influence the decision. One option is excision surgery, where a doctor removes the mole with a scalpel. This method is often used for larger moles or those that might be suspicious. It's a precise procedure that ensures the complete removal of the mole, reducing the risk of recurrence. It's like a tiny little operation on your skin. The area is numbed with local anesthesia, and the mole is carefully cut out, sometimes requiring stitches to close the wound. Post-surgery care is essential to prevent infection and ensure proper healing. This method is often used for larger moles or those that might be suspicious. Then there's shave removal. This is for those raised moles that are like little bumps on the skin. It's a less invasive option that can be done quickly and with minimal discomfort. The doctor uses a small blade to shave off the mole, usually leaving a smooth area that heals quickly. This method is ideal for moles that are not deeply rooted in the skin. It's less invasive than excision, but it might not be suitable for all moles. For instance, if the mole is flat or has irregular borders, other methods might be more appropriate. It's crucial to have a thorough consultation with a dermatologist to determine the best approach. Another option is cryotherapy, which sounds super fancy but is basically just freezing the mole off with liquid nitrogen. This method is quick and can be done in a dermatologist's office. It's particularly effective for smaller moles and those that are not deeply embedded in the skin. It sounds a little strange, but it's actually quite effective. The cold temperature destroys the mole tissue, causing it to fall off over time. Patients may experience some redness and swelling, but these side effects are usually temporary. And lastly, we have laser removal. This is a great option for smaller, flat moles. The laser targets the pigment in the mole, breaking it down and making it fade away. It's a precise method that minimizes damage to the surrounding skin. It's a non-invasive procedure with minimal recovery time. Over a few sessions, the mole gradually becomes less noticeable. Patients should follow post-treatment care instructions to achieve the best results. But before you go scheduling any mole removals, it's super important to talk to a dermatologist. They can examine the mole to make sure it's not cancerous and recommend the best removal method for you. A professional evaluation ensures that the chosen method is safe and effective. They're the experts and can examine the mole to make sure it's not cancerous and recommend the best removal method for you. Always prioritize your health and consult a professional before making any decisions about mole removal. Regular skin checkups can help detect any potential issues early. For those interested in home remedies, some people use apple cider vinegar, garlic, or iodine. However, these methods are not scientifically proven and can sometimes cause skin irritation or scarring. It's always best to seek professional advice before trying any home treatments. Preventive measures are also crucial. Protect your skin from excessive sun exposure by using sunscreen, wearing protective clothing, and avoiding peak sun hours. These steps can help prevent new moles from forming and reduce the risk of skin cancer. Remember, always consult with a dermatologist before trying any mole removal methods, whether at home or in a medical setting. Your health and safety come first. A professional can provide personalized advice and ensure that any treatment is appropriate for your specific situation. Chapter 4. Let's dive into the complexity of mole treatments. Understanding the various options available can help you make an informed decision. Are they simple or difficult? Well, it varies. Simple procedures like cryotherapy, which involves freezing the mole with liquid nitrogen, and laser removal, where concentrated light is used to break down the mole's pigment, are generally quick and relatively painless, allowing you to resume your daily activities almost immediately. These methods are often chosen for their convenience and minimal downtime. However, not all treatments are this straightforward. Some moles may require more attention due to their size or location. For larger moles or those with potential cancerous concerns, a more thorough examination is necessary to determine the best course of action. More complex procedures like excision surgery might be required. This involves cutting out the mole and some surrounding tissue. Excision surgery is more involved and may require stitches. The procedure is typically done under local anesthesia to minimize discomfort. In these cases, the removed mole is often sent for a biopsy to check for any signs of malignancy, ensuring that no cancerous cells are present. The biopsy results are crucial for determining if further treatment is needed. Your doctor will discuss the findings with you in detail. Regardless of the procedure, following aftercare instructions is crucial. Proper care helps prevent complications and promotes healing. Proper aftercare helps prevent infection and ensures optimal healing. This may include keeping the area clean and applying prescribed ointments, and ensures optimal healing. Most people heal within a week or two, with minimal scarring if the aftercare instructions are followed diligently. Most people heal within a week or two with only a faint mark left behind. Regular follow-ups with your dermatologist can help monitor the healing process, with only a faint mark left behind. So, while some treatments are simple, others can be more complex but are equally effective in ensuring your health and well-being. So, while some treatments are simple, others can be more complex but are equally effective. Always consult with your healthcare provider to choose the best option for you. Chapter 5. In this chapter we will delve into the crucial signs that indicate when you should be concerned about your moles. Understanding these signs can help you take proactive steps in maintaining your skin health. Now, it's important to remember that not all moles are created equal. Some moles are completely benign and pose no threat to your health. However, knowing the difference between harmless and potentially dangerous moles is essential. While most are harmless, there are some red flags to watch out for. These red flags can help you identify moles that may need further examination. Recognizing these signs early can lead to timely medical intervention. Think of it like this: your moles are like house guests. They usually blend in and don't cause any trouble. But just like house guests, some might overstay their welcome or start behaving oddly. Most of the time, they're perfectly well behaved. But every now and then, one might start acting a little suspicious. This is when you need to pay closer attention. Suspicious behavior in moles can be an early indicator of skin issues. That's where the ABCDE rule comes in. This rule is a helpful guide to evaluate your moles. Each letter stands for a specific characteristic to watch for. A is for asymmetry. Is one half of the mole different from the other? Asymmetry can be a warning sign. Symmetrical moles are generally less concerning. B is for border. Are the edges of the mole irregular or blurred? Uneven borders can indicate a problem. Clear, smooth borders are typically a good sign. C is for color. Does the mole have multiple colors or has the color changed? Moles with various colors should be checked. Uniform color is usually less worrisome. D is for diameter. Is the mole larger than 6 millimeters, about the size of a pencil eraser? Larger moles need more scrutiny. Smaller moles are often benign. E is for evolving. Has the mole changed in size, shape, or color? Any noticeable changes over time are significant. Stability in a mole's appearance is generally a positive sign. Changes in size are particularly concerning. If a mole starts to grow, it could be a sign of something more serious. Rapid growth is especially alarming. Similarly, changes in color, especially if a mole becomes darker or develops multiple colors, should not be ignored. Consistent color is a reassuring feature. Shape changes are also a red flag. If a mole that was once round or oval becomes irregular in shape, it's time to get it checked. Regular shapes are less likely to be problematic. If you notice any of these changes in a mole, or if you have any new moles that are concerning, it's time to schedule an appointment with your dermatologist right away. Don't wait until it's too late. Early action can prevent serious health issues. Early detection is key when it comes to skin cancer, and your dermatologist can help put your mind at ease or recommend the best course of action. Regular checkups and being vigilant about changes in your skin can make all the difference. Your health is worth the effort. Chapter 6. So, we've talked about why moles appear and how to get rid of them, but what about preventing them in the first place? Prevention is key to maintaining healthy skin and reducing the risk of complications down the line. By taking proactive measures, you can significantly lower the chances of developing new moles and ensure your skin remains healthy and vibrant. While we can't control everything, there are definitely some things we can do to reduce our risk of developing new moles. It's all about being proactive and taking care of our skin daily. This includes adopting a consistent skincare routine, being mindful of sun exposure, and making healthy lifestyle choices. First and foremost, sunscreen is your new best friend. Sunscreen acts as a barrier against harmful UV rays that can trigger the formation of new moles. Using a broad-spectrum sunscreen can protect your skin from both UVA and UVB rays, which are known to cause skin damage and increase the risk of moles. Make it a habit to apply sunscreen with an SPF of 30 or higher every single day, even on cloudy days. Remember, UV rays can penetrate through clouds and still affect your skin. Reapply every 2 hours, especially if you're swimming or sweating, to ensure continuous protection. Those UV rays are sneaky. They can cause damage even when you least expect it. It's important to be vigilant about sun protection, even during activities like driving or sitting by a window, as UV rays can penetrate glass. And speaking of UV rays, try to limit your exposure to the sun, especially during those peak hours when the sun is strongest. This is usually between 10 a.m. and 4 p.m. Seeking shade and planning outdoor activities for early morning or late afternoon can help minimize your risk. When you are out and about, cover up. Wearing protective clothing can significantly reduce your skin's exposure to harmful rays. Opt for tightly woven fabrics and clothing with a UPF, ultraviolet protection factor, rating for added protection. Wear protective clothing like long sleeves, pants, and a wide-brimmed hat. These simple steps can make a big difference. Additionally, consider using accessories like sun gloves and neck gaiters for extra coverage. And don't forget those sunglasses to protect your eyes. UV rays can also harm your eyes, so it's important to wear sunglasses that block out 100% of UV rays. Look for sunglasses labeled with UV 400 or 100% UV protection to ensure maximum safety. Another important step is to get to know your skin. Familiarize yourself with the moles and marks you already have. This awareness can help you detect any changes early and seek medical advice promptly. Perform regular skin checks at home, taking note of any new moles or any changes in existing ones. Early detection is crucial for effective treatment. Use a mirror or ask a partner to help you check hard-to-see areas like your back. And last but not least, schedule an annual skin check with your dermatologist. They can provide professional advice and catch any issues early. Regular checkups are essential for monitoring your skin's health and addressing any concerns. They have a trained eye and can spot any potential problems early on. Taking these preventive measures can help you maintain healthy skin and peace of mind. Your dermatologist can also recommend personalized skincare routines and treatments based on your skin type and needs. Additionally, maintaining a healthy lifestyle can also play a role in preventing moles. Eating a balanced diet rich in antioxidants can help protect your skin from damage. Foods like berries, nuts, and leafy greens are excellent choices for skin health. Regular exercise improves blood circulation and overall skin health. Staying hydrated by drinking plenty of water is also essential for keeping your skin healthy. Aim for at least 8 glasses of water a day to keep your skin hydrated and glowing. Avoiding smoking and excessive alcohol consumption can also benefit your skin. These habits can lead to skin damage and increase the risk of mole formation. Quitting smoking and moderating alcohol intake can have a positive impact on your overall skin health. Lastly, managing stress through relaxation techniques like meditation or hobbies can positively impact your skin health. Stress can affect your skin, so finding ways to relax is important. Activities like yoga, reading, or spending time in nature can help reduce stress levels. By incorporating these tips and strategies into your daily routine, you can take proactive steps to prevent moles and maintain healthy, beautiful skin. Consistency is key, so make these practices a regular part of your lifestyle for the best results. Moles are a common part of life and most are harmless. They can appear anywhere on the skin, alone or in groups, and usually develop during childhood or adolescence. But it's always better to stay informed and proactive about your skin health. Regular use of sunscreen and protective clothing can help prevent harmful changes in your moles. In this video, we discussed what moles are, why they form, and when to be concerned. We also covered the different types of moles and how to identify potentially dangerous ones. Remember, regular skin checks and consulting a dermatologist are key to maintaining healthy skin. Early detection of any changes can make a significant difference in treatment outcomes. If you found this video helpful, give it a thumbs up, and consider subscribing to our channel for more informative content. Share it with someone who might benefit, as spreading awareness can help others take better care of their skin. And don't forget to subscribe for more health and wellness tips. Feel free to leave any questions or comments below, and we'll do our best to address them in future videos. Thanks for watching, and we'll see you in the next video. Stay healthy and take care of your skin.